Welcome to Jefferson Close-Up. I'm Carol Saline, and my guest today is Dr. Alex Vaccaro. Well, welcome.
Hi.
You are the spine surgeon for the Eagles. That was pretty impressive.
I'm a lucky guy.
Yeah, but it was, I thought, kind of appropriate since you had been a quarterback in high school, and then you were voted the most athletic guy in your high school.
You were speaking to my mother recently.
Yes, she told me all these secrets about you. Okay. So I was curious, how is caring for big-time athletes different from caring for Joe Smith who comes into your office?
There's really no difference. We apply the same principles, the same care level. Everything's exactly the same. We look at different people, and different people come from different aspects of motivation. An athlete needs to get back to a job, especially in football, where they're hitting each other. So we have to make them feel better. We have to make sure they're fit to go back. So that's the only thing that's different. Other people come in, they say, listen, I have a sedentary job. I'm a secretary. I sit at a desk. I have a broken bone. We treat that one way. If you're a high-level athlete playing for a professional team, we have to be very careful because we have to be sure that they're ready to go back to a level of play and competition where they can injure themselves again. It's a balance.
So the treatments are the same, the approaches are different. I want to talk a little bit about your personal life. If you could come back as anything in the world other than a surgeon, what would that be?
An artist.
An artist?
An artist.
What do you do?
I got into watercolors, charcoal, and drawings, and I did it all the way up until I had no time to do anything besides operate as a surgeon. So in the beginning, when I used to write books for medicine, I used to illustrate my own textbooks. I illustrated my first textbook in college, actually. Wow. And now I am only praying to do it in the future. So I'm getting to that as I get older, and I'm building a house now, and I built an area that has a little studio in it. So I'm making it easier for me to get back into my old passions.
So someday we'll see your name on a canvas in an art gallery, maybe?
Well, who knows? Hopefully.
Well, I look forward to that. And I'll have it in so I can get it at a better price.
And an autograph for free.
Interesting. You know, when you talked about being an artist, I was curious, how does artistry translate into spine surgery?
Any type of operation we do in orthopedics, there's sort of an art to it. You have to take something that's broken, you have to put it back together, you have to make it look good, and form translates to function. If something looks good and it's in the right alignment, that patient most likely will function better. So there's sort of an artistry. And today I was operating, I was putting what they call bone grafts in the spine, and then I just sort of contoured it so it looked perfect just for the x-ray, which no one will ever see except me, yeah. And it has to look perfect. So that's the art of what we do. Okay.
What kind of surgeries do you perform, and how can you help these people?
I get involved when someone has a neurologic problem. Someone has leg pain and weakness, arm pain and weakness, difficulty walking, they have a scoliosis, they have a fracture, they have a spinal tumor and infection. That's when guys at my level would get involved.
When we were chatting, you mentioned that you're very interested particularly in spinal cord work and something called navigational surgery. What is that?
Sure. One of the ways of really pinpointing where we have to be in the spine, making sure when we make a move it's accurate, making sure when we put an implant or a screw it goes exactly where it needs to go, is to have computers and robots to help guide us. Uh-huh. So we have to believe in the technology because we're blind. The body is a three-dimensional structure, but we only see the surface of it. So we see sort of a two-dimensional flat picture on a screen. So we use computers to help us see beyond what we can see with our eyes. So you just can't introduce someone to that concept. You have to have a thorough understanding of anatomy and then believe in the science of what you're developing, that you can go into someone's body without seeing where you are to minimize any tissue disruption to lessen the potential for complications. So that's what navigational surgery is. It's just using computers and coordinates and imaging technology to see beyond what we can see on the surface.
Is there anything new in spine surgery that people could get excited about?
Well, there's a new stem cell project that was just recently approved for someone with an acute spinal cord injury in the thoracic, which is the upper spinal region, and using someone else's stem cells. We're now at this institution, we're applying to participate in that study. I'm also looking at the effectiveness of early surgery, getting into an operating room right after an insult occurs to the spinal cord and taking pressure off and stabilizing the spine to see if outcomes are better. I think they are, but we're trying to prove it with multi-center studies, so it's interesting.
So traditionally it's been wait until things calm down, and you're thinking maybe it's better to get in there before they calm down and just correct them?
That's my theory in the cervical spine or the neck region. Move in quickly, take the pressure off, make sure the blood supply is adequate, stabilize the spine. I think patients do better.
Also, someday you're saying maybe the people who have had spinal cord injuries might even walk again.
That's our goal eventually with stem cell surgery, safety mechanisms in society to prevent these injuries in the first place. Our surgical techniques, do what we need to do to make someone be happy, functional, and productive.
Well, I suspect that describes you. Thanks so much for being with us, Dr. Vaccaro. It's been a pleasure.
You're welcome.